It's number one, a testament of our love for other people and our care for other people, that we really want so badly for things to be in a better space, and the discouragement from the reality that keeps showing up. But I think that's an act of resistance to continue to push forward.
What if the healthcare system wasn't just broken, but was actually keeping people sick? Hey there, Health Feast listeners. Dr. Rock here. And in this episode, I'm thrilled to welcome Dr. Marsha-Gail Davis to the feast. You may know her as Dr. D, a board-certified physician, a leader in lifestyle medicine, and a fierce advocate for health equity. Marsha-Gail is someone who brings an incredible mix of energy, creativity, and passion to everything she does. And let me tell you, it is contagious. Marsha-Gail and I know each other through the American College of Lifestyle Medicine, and her leadership has inspired many of us to think bigger about what's possible in healthcare. One of the boldest and most memorable ways that she's delivered her message is through a project called WAC. It's a hip hop music video that's part health advocacy, part creative masterpiece, and all passion. But that's just the beginning. In our chat today, Marsha-Gail shares her journey from Jamaica to Georgia, shaped by her faith and upbringing, to becoming a physician who's determined to make health accessible and equitable for all. And we explore how lifestyle medicine can be delivered in ways that truly reach and empower every community. Marsha-Gail also emphasizes the power of small changes, how tiny, consistent actions can lead to big transformations. And she shares practical advice for anyone looking to take that first step towards better health. This is a conversation packed with passion, actionable ideas, and plenty of inspiration to help you rethink what healthcare could look like. So, whether you're on a walk, commuting home, or maybe taking a break between creative projects of your own, this episode is the perfect companion. Let's dive into Marsha-Gail's story and explore how her work is changing lives one bold move at a time. So let's do the show. MGD in the house at the Health Feast. Super excited to have you here. Dr. Marsha-Gail Davis. I was sharing a little bit in our introduction, but Marsha-Gail, you and I met through HEAL. HEAL is the American College of Lifestyle Medicine's Health Equity Initiative. Specifically, it stands for Health Equity Achieved Through Lifestyle. And then we started meeting though, like in 2020, and
Yes.
It was actually perfect for, like, I was working in the hospital. It was the pandemic, and this was like a little refuge where I would like get away from all the craziness of COVID in the hospital and at home, and just connect with all these really like-minded people who had this larger vision for our society. You were the leader at the time, and it had such a impact on me, to be honest. I mean, I still say, I know you didn't come up with this phrase, but I still say it in my house all the time. And I think of you, teamwork makes the dream work. And you used to say that at our HEAL meetings. I just wanted to share that with you because I don't know if I've ever shared that gratitude with you.
Wow, that's awesome, man. So that goes into what I believe we inspire each other as humans, and everybody, across the board. One little thing that you never thought was that someone can capture that, and they take it, and then it actually goes into them and they do something with it. Like that's the beauty of humanity connected.
So, beautiful. So to start, I'm curious, what was it in your life or your career that has made you so passionate about health equity? And was there a moment or an experience where you said this has to change?
It's just seeing that it's not fair, that health is something that people are being robbed of. And then when they're robbed of their health, they're robbed of their life experience. And that's their life experience, which they can't take back. The time just keeps moving forward. So it's like, this is critical. Like, we have to start trying to make a dent in this, because this is really people's lives on the line. And, just thinking about experiences, seeing patients going through the health system and seeing the kind of outcomes, the health disparities in action as a medical student, as a resident, as a practicing physician, and just seeing, and you feel it too. You're like, this is not, so many stories, so many experiences, having certain patients coming in and the way that people would explain things to them, or the fact that I would hear stories of patients not being the consent with certain procedures and surgeries not being discussed with them. When I would kind of circle back, I'm asking the patient and they didn't know that they had a hysterectomy and that all the organs were removed. And that was like, oh, I didn't know that. It's like, that's what happened. That's what this was done. Like how, and then finding myself in situations where I'm like making sure that is happening and there's a little pushback. It's like work to find a translator to talk to this patient about their surgery. And I'm like, but that has to happen so the patient understands what is going on.
Yeah.
Just all these different experiences. And then when I would go to ACLM conferences before as a medical student, this was...
How did you find out? How did you even find out about it?
Oh, how did I get to ACLM? As a college,
I'm always curious how people find lifestyle medicine, because it's, especially like several years ago, it was a little bit more hidden than it is now.
And I think, definitely it was right at the time that I found it. I felt like it was starting to really blossom. But I grew up, I'm Adventist. I grew up Adventist, so I've already known about the health message. So that was kind of in me already.
Oh, you're Seventh-day Adventist. Got it.
Mm-hmm. And I grew up with that understanding of the importance of health. So I was already really interested in that. And then I also
Can you just share with our listeners a little bit about like how the belief system ties in, and like for those that aren't aware?
Well, I'm not going to say I'm a representative of everybody. For one, the way that I look right now, there's a spectrum of how people can exist with their beliefs. But my experience is that a part of the doctrine, if we use that term to describe what people believe, is really has a lot of roots in your health as well. So it's the idea that your body is a temple of the Holy Spirit. God lives in you, and you want him to live in a person that is in a healthful place. This is something that's been gifted to you, and you want to respect that gift and then take care of it. Someone's giving you a car, you take care of it. Someone's giving you something, you take care of it. So that's kind of the underlying thing. And so with that, then we have all these different pieces of health, and the term is the health message. That's what, when people talk about health and their spiritual life in the Adventist community, the health message is the way it's described. And all of the pillars are the health message.
It's like all the pillars of lifestyle medicine.
Yeah. Mm-hmm. So eating well, they're actually acronyms that are used in the Adventist community. Celebration is one, New Start, and each of those stands for, nutrition, exercise, sleeping well, stress management. And nature, air, and water are three other ones that are included, and that's all like nature therapy, which a lot of people in the ACLM community are trying to bring in as the seventh pillar. You see?
Oh yeah, Melissa's gonna be on our podcast actually next month.
Perfect. So it's all rooted in that, and so it's so interesting to see how the only blue zone that we have in the U.S. is the Adventist community. I don't think that's a mistake.
Right.
And I actually think there's a divine nature to that myself.
That's large. So you grew up, where did you grow up?
I grew up partly in Jamaica.
Okay.
And then the other half of my adolescence, because I graduated when I was about 16. So 8 years in Jamaica, then 8 years in Georgia. 8 years in the U.S., 6 years in Georgia. But that was kind of my...
Is there a large Adventist community in Jamaica?
Yes.
Oh, interesting.
Yeah. Yes. It's very, yes. So there's a large Christian community in Jamaica, but in particular Adventists, compared to other places, there's a high concentration. There's a high concentration of Adventists in Jamaica compared to other countries. So per capita is a higher.
Okay. So health had always been a part of your kind of upbringing and your faith, your belief system, but then so how did you connect with American College of Lifestyle Medicine or find out about lifestyle medicine?
So that was already a part of my structure, my frameworks, and then I thought that I wanted to become vegetarian as a teenager. And I never made the jump officially, but I was starting to do my research. And I think I stumbled on raw food first. And the book was Ani Fayo, I think that's her name. She's a raw food chef. And I got her book. And I was considering going that route first. But I was like, man, I really like cooked food. I like hot food. Like that's why I grew up, like soup and, rice and entrees, chicken, it's like hot food. I just can't with the cold food. So I was like, I don't know if I'm going to go all the way with it.
Right.
And then my sister actually was the one who really made the jump to say, I'm going to try this vegetarian thing. So I kind of jumped on it with her, and I would do this half a time, eating vegetarian, half the time going back. And I would just kind of do that back and forth for a while until I remember very distinctly, I was in my cafeteria at Swarthmore College, which is my alma mater. And I had 2 pieces of chicken on the plate and some other stuff. But that was like that was a return to say, okay, I'm going to come back to the usual. And I bit into that chicken and it just was like, I just didn't have the taste for it anymore. It just didn't really do anything for me. I'm like, this is a lot of meat. I'm not enjoying this. That was kind of
that was the moment right there. And then you were like, I don't want this anymore.
I just didn't have the taste for it. I was just like, I think I'm kind of done with this. And then it just kind of moved forward from there. That was 2010-ish, and then I really officially said, okay, I think I'm going to transition to this fully with a consciousness to do that.
Yeah. That's fascinating to me because I became a vegetarian in college, and that was for kind of spiritual reasons. And it was really hard for me. Like I loved meat so much. And as a result, I ate all this. Back then I would eat everything fake and processed that tastes like meat. So now I'm vegan, and I still enjoy things that are like meaty, but I've found healthier ways to eat that food. And I don't miss meat in the way that I used to crave it like I used to. Right. So you just, up and decided I don't care for this anymore. That's really interesting.
But I guess I'm painting the picture that I had time to do that. I had a foundation already from way back. Right. So it was already kind of in the thought. And then that was just the little straw that broke the camel's back. My sister. Kind of, I'm starting and I'm like, okay, I'm going to do it. And then what happens is that I keep going. People start stuff and then I finish it.
So, okay. But then ACLM specifically, when did you?
Oh, sorry. I got off on a tangent. No, so that was kind of my research. And then I started finding, I think Dr. Barnard was. Yeah. Okay. I found him, and then I found Dr. McDougall, and then I'm like, ACLM, that's kind of how it. Right. I remember those two guys, and then ACLM, I ended up with that.
This is when you were in college.
This is when I was in college.
Oh, wow. Okay. So even before, and when did you know you wanted to be a doctor?
That was in college.
Yeah. What kind of prompted that? And was it tied into your then new kind of your interest in lifestyle?
It was. And I would say I wasn't the young person who knew I would be a doctor from when they were a kid. I was always in love with science and biology in particular. I just love nature and how amazing it is. I really am enthralled by nature because I'm like, how is this real that we live and see this happening? This is like miracles every day. The human body to be functioning, I believe that's a miracle every day because it's just so complicated and somehow it's like intact.
Yeah. All the time. It's pumping blood all the time. Like, how are we? Yeah.
Self-repairing. It's like, this is amazing. So I was already in thought with that. And then I was kind of in a bit of a, I don't know what I'm doing because I'm a thinker. And so, people who think tend to overthink, and then you get kind of worried, are you going to make the right decision? And should I do this? And this is because my sister's a physician, and I'm getting that push from, you have your...
Am I doing it for the right reasons?
All of that.
Yeah.
And so I said, let me just get exposed and then maybe I can make a better decision. Because I was really undecided even going into my last year. And there was an externship at the college where I was able to shadow an OB-GYN who was amazing. And I got to see my first birth. I got to see a placenta in real life. I got to see a uterine ablation. And I was just thinking to myself, like, this body is ridiculous. Like, how did this thing come out of there, this baby? And then this placenta, you could see all the blood vessels. It looked fake. It looked almost like plastic. Like, this is a real organ. This is a real thing. So I was like, I could learn about the body all day. All right, I'm sold. I could do this medicine thing. And then my whole focus was like, okay, if I'm going into medicine, then I'm going to be preventive because that's what you do.
Yeah, that's what you do.
You help people stay healthy. So that was how I went into it, with that very naive, idealist nature, which is how I am. I'm like, this is what it is, right? This is what the doctor does. And from there, and also because interacting with people, really, getting to know people, that was also a part of it. So I said I can combine all three of these in this path.
Yeah. Wow. How naive you were.
But naivety proves to be a strength in many cases. So I was like, it worked out.
No, you probably do too. I have now like younger people sometimes reaching out to me. They're in college or med school and they're asking me, they're like, with healthcare the way it is, like, because they're interested in lifestyle medicine. They're like hearing about lifestyle medicine, but they're like, with healthcare the way it is, with medicine the way it's being practiced, like, should I even do this?
Wow. Look at that. That's a real
right
question.
And my answer is always like, no, we need you, like specifically people like us, to go into healthcare because that's what we're working to change. But I'm curious how you work in a like busy conventional primary care system.
Yes.
So how do you reconcile the like naive visions you had for what you wanted to do and what you're actually doing now?
So I actually thought about it when I was finishing up with my second residency, preventive medicine. I did internal medicine first, then preventive medicine. And I was like, okay, what are we going to do now? Because I know what makes sense. And I know that I don't want to be constrained. And I don't want to exist in a system that is really supporting the management of illnesses rather than the root cause, because I'm so root cause oriented. Also, my personality is very like, if there's a problem, fix it. Like, let's stop with this dilly-dallying, like all of this sidestepping. What's the issue? Let's get to that. So it didn't even make sense with my own personality. But then I also said, I need experience. I actually want to independently practice so that I can get that experience. And maybe it's not the best step to just like jump out and haven't really gotten the lay of the land and gain knowledge. If I understand the system, maybe I'll be able to change it better. So I should get in there. So that was kind of my step into it. And I think it was useful, even though it was difficult. And 3 years in, learned a lot. There are days where I'm just like, oh, I can't with the system.
I know.
But there are other days that I get some messages from patients and I'm like, wow, okay. Me being here is actually helping people, even in this system. So I take all of that and I'm like, all right, let me just keep thinking. Let me keep formulating and settling into quiet so I can know what my steps are. That's kind of how I'm moving now. But I can definitely understand a budding physician coming through. I've had young physicians talking to me as well. And I explain it as you have a lot of options. You can actually create a career because people show that you can do that without having to go into the system. But then you can also create a career where you go in and you begin to change the system. Michelle McMacken, Terry Stone, they're in health systems and they're beginning to bring lifestyle medicine
Yeah.
our way that's being distributed,
Yeah.
scaled. So there are opportunities everywhere.
Totally. I mean, one of the things I love about our organization, American College of Life, I mean, there's so many things I love, but at its core, it has been, and from the beginning, has been very strategic. And how are we, like, there's a vision in mind. The vision is that, lifestyle should be the root, the fundamental, the foundation of healthcare.
Right.
And then like, how are we going to get there? So that's what I tell young people too, is like, we're figuring this out. Change is messy, right? Like for personally, and even for this, like, we have like the most gigantic behemoth healthcare system, sick care system.
It is
right?
the one. It is like there's none that compares to it. The way it's so
nothing compares to it.
Ridiculous.
I often say this. I'm like, this is probably the best place to get sick if you have insurance. If someone's paying for it, but it's not. I mean, it's by far the one of the worst places to be healthy and get healthy. Yeah.
Right.
So as a doctor, like, there's only so much we can do, right? I mean, how do you reconcile that? I'm curious, even in your practice, like where you have probably how long are your visits? Like, how are you supporting people to make lifestyle change?
I have learned to be observant, and I've learned to listen, and I've learned to let patients teach me things about how to approach people. I have learned that small steps are very valuable, and I've learned how to be equitable in the delivery of it. What someone needs, knowing kind of their pain points. You can't approach everybody the same way. That doesn't work in life. That nothing is ever like that. There's always a spectrum, and you have an idea of how you want to approach things, but you get so many different people. I have the patients that once I give them the information, they're done. It's a done deal. They're off. The next time I see them, they lost 40 pounds, blah, blah, blah. That's a personality type. That's on the 20% of the bell curve, the standard deviation of 1 to 2. They just
needed the information. Then they're ready to go. That's that's a small.
Then you have the person who doesn't have the skills. They really want to do it. They know, but they don't know how to make it work in their life. And they're feeling also a lot of times stress. That is a barrier, and getting out of that like survival mode can be difficult because you don't see opportunity in survival mode. And then you have the people who their emotional ties there, the actual barriers from the standpoint of internal things. They're dealing with things, trauma, experiences that are blocks, and they're just blocked. They actually have blocks that need to be removed. Then you have people who are the laggards. They're on the other side of the bell curve. Whatever you tell them, they're like, I'm doing my own thing. Don't try to change me. And then you just let them be. So you kind of know how people are. You have a spectrum of different types of people that you interact with. And then you have people that when you give them the right framework, it clicks for them. And that sometimes takes a little wearing down or a little, trying different angles.
Yeah. They have to build up this new identity, like this new belief. Because I think a lot of times people just don't even believe that, like you said, they don't even believe that that's them, they're not the type of person
that's right
could make those changes. So you're helping them build that belief, and meeting them where they're at.
So that's what I try to do in my day-to-day. And
while you're also probably seeing, all these urgent complaints and getting all these messages and getting all these. I know I worked in a very busy primary care clinic. I only lasted a year, and I hear what you're saying though. Like I actually did that. I worked in the hospital for 12 years, and I did that in part to what you're saying. I was like, if I want to change the system, I really need to understand like how the system is working and not working right now. And I would try, just as you're saying, like I would basically like enter the conversation whenever possible and when it seemed like the patient was ready. And there were so many forces. I don't know if you feel this on a regular basis. Like there's so many forces that are like kind of working against you to do that. You know what I mean? And so you just have to, you take the wins, like the good things that you're able to do, and then you kind of work and changing the system. Yeah. How are you working to change your system?
So I'm getting the sense like, okay, when I give patients the information, they really grab onto it. But then it's the getting the consistency in place, which a culture does that without even trying. Culture gives people consistency because it sets a standard of what is a normal. If we can create culture around patients, that would be great. One of the ways we can do that is with group visits, which we know so much about from our lifestyle medicine community. So that's where I'm moving to create that program. I'm like in the midst of trying to make that happen. So it's good. Yeah. I'm hoping next year I'll be able to have something in the works, operating or operationalize. But that's one step into it. And we see the ramifications of these little things. I love, that's why I'm referring back to Michelle. Now I'm Dr. McMacken, because that's an example of one person, literally one person having a change of their experience and driving their passion into
the whole system.
And then you have people who see that, because it doesn't happen without multiple people, but people begin to catch on to that passion and want to be involved. And now we have multiple systems, multiple hospitals through a healthcare system that's actually implementing lifestyle medicine on a grand scale. That's amazing.
That's amazing.
That just came from one person, you know? So.
Yeah. The power of an individual. I was working in a large healthcare system, and that's what I used to tell myself. Like, oh, you have to just be patient, and like change, especially change in like a big system, takes time. And then I think I just got really impatient. I was like, I don't want to wait to do this work. Like, I know this is the work I want to do, but I think it requires both. This is why I tell all these young people, oh, you should definitely go into healthcare, because, you know, we can't change the system unless we have like-minded people that are entering it and working in it, that are working to change the system.
You're right about that. You need them on both sides. You need the people who are able to do it every day to say, see, again, proof, it works. And then it's like, okay, so now let's all get in here and
actually do it. Yeah. Can you just actually share? So I think we talk about this all the time, but I would love for you to share this, this juxtaposition or this intersection between health equity and lifestyle. You know, I mentioned the group is health equity achieved through lifestyle. And just for our listeners, like, what does that mean?
So I have actually added on something else to that. So we have health equity achieved through lifestyle medicine, which there's opportunity to make shifts in people's health with lifestyle medicine itself. But then also lifestyle medicine is delivered in an equitable way. So I think it's front and back. And that's something, that's like something I've kind of said that's added to it, because the way that you deliver lifestyle medicine is how it becomes available to everybody.
I would say that there's a perception that like healthy eating and exercise and meditation, these are things that you do, you know, things that, you know, people who are more privileged are able to do. Like, this is maybe a perception, but to your point, I mean, the people who often need it the most, everyone needs it really, are the least likely to be offered that type of care.
And so it's like, there are a lot of barriers to why people can't get in there. You know, we have the barriers constructed from social determinants of health that make it harder for people to get into this easily. So there are barriers created by these limitations of living. You know, and those are deeply, like, there's a whole history as to why that's the case, right? Going back to, if we're looking at the U.S. as a nation, we have all of the backdrop of the founding of the U.S. with slavery as a big part of it. And then institutionalized racism that's kind of permeated. And then, you know, you think about these barriers that are in people's way. That's why it's not apples and oranges. And that's why we have to actually Equitable care is realizing the barriers that are there and identifying them and then figuring out strategies to get around them. Because without it, you're going through trying to get over to the other side and you're hitting all these walls and you're like, see, can't do anything.
Yeah.
But you can if you get around the barriers. So the framework is important, very much so. And I think the conversations are to identify these barriers and then to develop the solutions that can be implemented with consistency, where we can start to see outcomes change because we're implementing things that actually get us around the barriers consistently.
Yeah. So I think that's a great point. I think a good example would be like a hospital starting a food pharmacy, and doing
which hospitals have.
Yeah, which many hospitals have now. And I used to volunteer at where I did my training at UCSF as a food pharmacy every week. And in the clinic, the doctors could prescribe it. And that's the people who then can pick up a box of produce every week. That it's all volunteer run, and they get a lot of donations of, produce. There's so many farms around here, but it takes that creativity and kind of initiative, because that's not the traditional way that healthcare is practiced. Yeah. I do. I'd love to see, like, what would you love to see our healthcare system become? Like, how if Marsha-Gail was what?
My ideal. How
your ideal. Like, what's your vision? If you could paint your brush, and what would it look like?
It would look like our intention, our practice with patients and the community. So a baseline, the way medicine should be practiced should be connected to community. That's the first thing, because in the US, it's very separate. You have this idea of public health and you have this idea of clinical medicine, and they're not even in tune with each other. We see them as separate practices. Like, you have a whole book on public health that is like this little clinical section versus saying, here's part 2 of the health system, public health, or part 1 of the health system, public health, or part 2, the clinical medicine. They're like separate practices, which there we go. That's the problem right there. So we should have clinical medicine and public health together, because community is where health happens. We need to have a foundation on prevention. So everything that we're focusing on is really decreasing our outcomes by decreasing the likelihood of this thing happening, and implementing systems to help people live daily in health. So our goal is for people to achieve health versus our goal is to treat illnesses.
Right.
And we have that permeate through everything we do. So when patients come in, every provider is already creating this kind of culture of, we are concerned about your health and we want you to limit development of diseases. So we ask you about what you're eating and how you're exercising. That's something that's not even standard. We have a lot of studies that show that providers don't across the board ask these questions.
Right.
And just asking the question actually makes a patient think differently.
Yeah.
We should have in our hospitals the food that we provide to patients not make them sick. And literally cause the very diseases that they're going to the hospital for.
Yeah.
It's actually similar to what David said at the conference, where he said at the funeral of our church member, they're serving the same food that put the church member in the grave.
Right.
So that would be an example of how it permeates, and provide people with foods that are healing and cheaper. So like, it makes sense, but it's just a standard to provide the easy stuff. And then we have community engagement. I went to visited China in 2011. And it was amazing to go outside and see these people who are 60 plus exercising together in community. And they're on the little metal, apparatuses. They're all these different types of exercise devices. And they're all out there doing their thing. And I'm like, this is a lot of older people out here.
Wow.
But it was community. You saw at least 20 people out there as we were passing, on the bus. It's prevention focused. It's permeated in the practice of the medicine. With the way that we pay for things drives behavior. We know that. So our payment is going to pay for the quality of care and the quality of life that we can help a patient achieve. You know, all the things.
I hear that. Like right now, a lot of our quality metrics are so misaligned with health.
So
right?
misaligned.
Like, I used to get dinged when I would take people off a cholesterol medicine if they were diabetic.
Which is a mess.
which is a mess. Like, I would get in trouble, but I was like, no, their cholesterol is controlled now because I helped them make diet changes. And they'd be like, it doesn't matter. The metric says that we have to have them on a statin. I'm like, they don't need a statin. So I would get in these arguments with, with the pharmacist or whoever. And, and then I would just have to write, which is true, like the patient refused. Like, cause I guess that gets them off the hook. I don't really understand it, but it's like a numbers game oftentimes for these quality metrics, which, here's a great example, the A1C, you should get the A1C below 7.5 or whatever the newest metric is. What's the easiest way to do that? Is like, especially if they're really poorly controlled, is to put them on insulin. And insulin is like, worse. It's like, it's adding, gasoline to a fire. In someone who has insulin resistance, we're like, oh, here's more insulin. This is how you overcome it. That's to meet the metric. And to be really proud that like, oh, we have like 80% or 90% of our diabetics are controlled. Right. But to your point, it's like somehow we've so been disconnected. Like, could the metrics actually reflect someone's health, their quality of life? None of that is, present in the current system. So I love what you're envisioning. It's like, how do we encapsulate someone's health and incentivize what you said? It's always the money, right? How do you incentivize people's health?
I think that there's always that. Like, money will continue to drive behavior very strongly unless people change how they're providing the money. So you can that will always be a push, but you can divert the money by diverting people. So when patients start to get this taste of, right, because then the money is talking in a different way. Yeah. So patients start to get a taste of, I really like when my doctor is invested in me living a long life and getting me to a place of health where I can really enjoy my life. People appreciate that. There's a lot of value in you seeing them as valuable enough that you feel like their health is important because their life is important. People really, it hits them here in their heart. So then they're like, okay, let me tell such and such of my friends, come to this doctor. But you have people kind of thinking this way moving forward, like, I like this. So now you have people behaving a little bit differently. And now you have a cohort. Now you have potential for community. Now you have potential for voices to be heard, right? In a way that hospitals can hear, to say, wow, all of these patients say, how come we don't have this at this hospital?
Right.
If enough people talk about that, hospitals listen.
Yeah.
Because now it's like the community can drive perception of the care that you provide. And that's very important to a hospital. Metrics, scores. Are we providing the kind of care?
That is true. Patient satisfaction scores. So yeah, it's a really interesting point. Like, that is probably an underutilized, or, the way forward is actually getting patients to the ones who are receiving the care. They're the ones who should be asking for this. And if they get it, to your point, from somebody like you, they're going to tell their friends. You probably get all these requests. I remember even just the year I did primary care, like within a few months I was getting like, oh, can you add my cousin to your panel? Can you, right? It's like, they all want a doctor like that when they find out that it's somebody who cares about your health.
Right.
There's so many people who are like, I want that doctor.
It is really, just as a moment, just reflect, it's really crazy that this is like a minority of practice. And this is not a blame on people to say other providers are not having this care. It's because they're in the system and they're just being a part of the bell curve. We are like, no, we're over here on the 20%. We're like, no, I'm being driven by my passion. But that is so refreshing to people, that they have such a strong response to that kind of care, that it actually is really powerful. and it can actually drive a lot more movement in that direction.
I think you also said it. You said there's going to need to be more people who are doing this type of care. And that, I think, inherent in what you're saying is like we need a much larger primary care workforce. We already do, right? To maintain what we're doing now, which is this kind of broken sick care system that is in many places just being like, is a patchwork that's kind of getting us through, but not with very good health outcomes. We're already short. We're going to be short and continue to be short of primary care doctors. And I think that speaks to also the system doesn't incentivize young doctors to go in. They look at the job, they look at the amount of debt they have.
Right.
They look at
the energy, the effort, all the things. Yeah.
And they're like, why would I do that? And so we have to create a pathway. This is also what I tell these young people, where there is a future where, you have a reasonable panel size, but to your point, actually, you have strong relationships. I think this is what medicine it has lost, this art of, the relationship and the connection that people have had in the past with their doctor.
Right.
Is really like now we are moved into a phase of corporate medicine where a lot of that is unfortunately lost. I think doctors are really well-intentioned and most people, I think, work within their confines to try and do the best they can.
Yeah.
Yeah.
Yeah. And I don't take the blame on, doctors just want to push, like that's missing the point, and that's not a big picture view.
Yeah.
The big picture view is it's a system, and people are people, and we have a bell curve, and people will defer to what is at the middle, which is the system is operating in a management treatment fashion. But I also think it's so interesting because we as providers are not satisfied with how we're able to deliver care to people. That's why we have, and I was talking about this with my friend Jackie Salomon. She's also in Heal. Remember?
And yes, Jackie. Oh, yes.
Amazing fight. Like she's just
I've been wanting to have her on the podcast, actually. Seriously.
But that's the thing. So we have burnout, we have physician shortage, we have frustrations with the insurance company, with how we're able to provide medications to people. We have, medical students choosing specialties outside of primary care preferentially. So that's a chronic disease symptom because our healthcare system is
That's the chronic disease of our healthcare system. Yeah.
Then we have the patients on the other side, feeling that their care is subpar. They don't have enough time. Doctors don't talk to them about their lifestyle. They feel
they refer them for everything.
Right. Everything is like you do a little bit and then it's like, oh, this is
here. Go see this endocrinologist. Go see this hematologist. Go see this.
Right. And so they feel like they're just kind of jumping around. And then you look at a patient's chart, you're like, you see 6 specialists. My gosh. Wow. That's a lot of doctor's visits. And then you see the burden on the patient's life. The doctor's visits are a burden in and of themselves. So the patients aren't satisfied. The doctors aren't satisfied. We're in the same boat together.
Yeah, that's right. It's not working as well as it should for anyone.
For both parties, yeah.
For both parties.
Mm-hmm. So I think patients and providers can actually link on that to say, we want differently. Like that's a powerful union. And I don't think we've really accessed the connection with patients and the power that they have, connection with doctors and the power that they have to mobilize together, to bring some of these changes. I think that's an untapped union, untapped connection.
For sure. And I want to actually, this is a great moment to sort of bring up kind of one of the ways you've been trying to increase the visibility of the ills of our not just our healthcare system, but our food system is through your creative work. And I know you do a lot of creative work, and it's really fun to see. And one of the things you did was make this incredible music video called Whack. And we'll share the website in the show notes, but why don't we watch a little bit of it? Okay, so I just have to say, it's bold, it's memorable, it's totally unexpected for health education. And so what inspired you to make this? And tell us a little bit more about it.
So the inspiration really was from, it comes from dissatisfaction, frustration, realizing there's a problem and wanting to do something about it, the passion to say, we need to do something about this. So that was me as a third-year medical student, just reflecting on my experience thus far, being this kind of soul. Maybe I'm not gonna use evangelist, but because I wasn't to that event, not in that way. It was more of I felt like I was the one.
You're an advocate.
That was, yeah, there we go. Thank you for that. Advocate for the importance of lifestyle. And I really felt like I was seen in that way, where my colleagues, my classmates saw me as that lifestyle person, which I feel happy about, because it's like, it was clearly that passion was coming out to me, that people identified me in that way. But it was through that, just reflecting, like, this is, do I even want to go into this system with all this craziness? That was a poem that I wrote to just express myself. And it was published in our literary magazine on campus. The medical school had one.
I see. So it started as a poem, a written poem.
Yes, started as a poem. And then I took it to intern year, and I decided to do it as a spoken word, which was such a whim. Like, I'm not a spoken word artist. I just said, they had this talent show. They said, do you want to do anything for the talent show? I said, you know what? Let me just do it as a spoken word. Let me just be brave and just push myself into something uncomfortable. And that's not my thing. So I was, out of my comfort zone, but I love that. And from there, circle back a couple years after in residency, I would say at that point, the stress of residency was on me. And I had essentially not realized how much I pulled away from my creative expression. And I could see the impact on me. And I was reaching back for it at that moment. So I found a beat online. I was just playing around with it. I'm like, oh, hold up. This goes
well.
And so we end up with a song. We end up with hip hop.
Who did the art and the editing? Was that all you, or?
No, that was my media guy, Brian.
Okay.
And I met him through Big Picture Learning, which is an organization that I work with and very connected to. I'm actually on their board of directors, and he was a creative guy, and I said, you know what, let's try this. Let me see what you got. And he killed it.
Yeah, so, seriously. Oh my God, he more than killed it. You both killed it. It's really, really cool. Is there, now you do a lot, you're Dr. D on Instagram. And I want you to talk a little bit about the role of creativity in medicine, and also in this kind of advocacy work, and how you're leveraging it, and what you see its role is.
I think it's an amazing tool because it's able to break through barriers. That's what music does. Music is a pillar of our society. It carries us through our experiences, and it inputs different types of feelings and emotions and frames of life into people. There are many times people have said music has gotten me through, or the song was a soundtrack of my life.
Yes.
Or after hearing it, I just kept thinking about those lyrics. It's powerful stuff. It cuts through all of the clutter, and it gets to the heart of things. So I think that's why it's one of the pillars of our society, and so much of our culture is embedded in music. So it just has this ability to carry people together.
Did you go to the talk this last conference with Dean and Aisha Shirzai?
I was behind because we were doing the fellows thing. So we were able to really pay attention.
Oh, okay. Well, they had us all sing together at the end. You heard about that, yeah. And we were singing some Beatles songs, and it was so cool. We were in a room of, a couple thousand people. Yeah.
And just that experience left something very positive in you, because you can see it. You're like, I love that. Yeah. So I feel like we can use that as a tool to share information, to educate, to move people together. And I think that's something we should really think about. How do we get lifestyle medicine into popular culture? as a part of the conversation. That's one vehicle, media, music. There's a cultural currency with celebrity, but I don't think that's something that should be used all the time. I think it's kind of like a little icing. People of influence can be positioned to have influence in a way that is authentic and is really getting at driving things in the right direction. Sometimes I think we rely too much on celebrities. We're like, oh, I pull them in for that, for that. And it's like, are they aligned with us? We need to be just authentic. That's where it's part.
I hear what you're saying. It's like I think what you're doing is amazing because more people need to learn about this. And this is how people are consuming, young people in particular, but really everyone, this is how they're consuming information through these platforms. And so we can either just be like weary of it. Like I used to say like, oh, I don't like those platforms. They're just causing all these problems. But then it's like, well, to your point, like if you gain influence, and I think of like, was Spider-Man, right? Where his dad said to him, with great power comes great responsibility. It's the same idea. With influence comes responsibility. And to your point, a lot of celebrities have a lot of influence. They don't necessarily use it responsibly.
Right.
But you're building up influence. I mean, I'd probably say the same thing about me. Like we're building up influence with the goal of helping people, empowering people to learn about this.
And I think that's powerful.
That's powerful. Yeah, for sure. And I love what you're doing because you do and you said earlier, like really like in clinic, you're emphasizing small changes. And I see that in the content you put out too. It's like, what can I do in 1 minute to move my body? You'll do something like that. Or what's like a breath work exercise I can do in this minute? Because people maybe like, they need that. And then they also need to build this identity and this belief that this is something I can do.
And I also believe that identity building happens in community and culture too. Sometimes we think somewhat like there's a lot of focus on internal work, right? That's why we have such a self-help culture in the US. Everything's like look inside and figure it out and get that strength to transform yourself and move forward. But in many ways, that transformation sometimes for some people doesn't happen until they've kind of been marinating in a different type of mindset that's coming from other people. To say, you know what, I really can do it. I've been hanging out with this person and now I feel like I have more confidence to do such and such. So the community piece is something that I think as it pertains to health equity is one of the most powerful tools we have. And Dr. David Bowman and Keisha Bowman, his wife, and Faith.
No, I'm doing their 21-day Daniel fast right now.
Oh, that's wonderful.
It's really, I mean, it's really, with David. I did a cook along with Dave. Yeah, I did a cook along. We did a cook along on Saturday. We made butternut squash soup. It was a lot of fun. But they have these like prayer sessions, but they're 7 a.m. Eastern and I'm on the West Coast. So those I have not, unfortunately, they're at 4 a.m. Like the first day I was like, I'm going to try. And I woke up at 4:30. I was like, I'm going to go back to sleep.
It's no joke. It's a fast for short. But
it's bringing a lot of, the reason I did it is because I found myself actually eating more like recently, especially with like news and stress, like reaching for some more processed food, plant-based food, but like processed plant-based food. And it just doesn't feel good. And I wanted to bring more awareness. I think the whole reason they do it is just to bring more awareness about what you're putting in your body and like making sure that you're reading labels. And I had, done all those things, but all of us can get away from that,
Oh yeah. It's a practice. Lifestyle, your choice every day to do something that's the little coin you're paying every day, your day, We can always veer off because we're dynamic. We're not permanent as humans. That's life's experience. We're running every day. Either we're running in one direction or the other.
That's right.
But I wanted to just go back to the community piece.
Yes.
And just describe like what they showed was really amazing. They have church communities where they implement these programs and it's such a smart thing to use an already established community. No, you're just superimposing and not even superimposing, you're melding, bringing things together in a way that fits for the community. But
Right.
the carrying out of that is very easy because it's already in place.
Yeah.
So church communities as a vehicle for health equity, I think is like one of the top things.
Yeah. Beautiful marriage, because you think about like that's a community of faith where people actually that's what they want. They want like what is best for their congregation, for all their fellow practitioners. Like you're now giving them a method that can elevate everyone's health and their life. And you know, it's powerful to actually think about spreading that message in so many faith-based communities. I mean, that's what I know you've been working on, the HEAL's been working on, and to see the kind of ripple effect of that is really cool. Yeah.
So more opportunities that we identify, and you know, that's our movement towards creating more of those.
Okay, I love to ask people, because you're a busy doctor and doing a lot of things. I heard you're on a board. You're probably doing all sorts of professional activities. How do you take care of yourself? How do you, what's your sort of routines that help you?
So speaking from personal experience with small steps, that's why I really believe in them, because I believe that there are certain laws in our world. We like to think everything's kind of relative, but you jump off of a cliff, we already know what the deal is. Like that's a law. It's called the law of gravity. So we also have the law of consistency. That's compounding interest. That is wearing down of a stone. That is picking at a wall, and eventually when you get to that last pick, it all crumbles. All of that is the power of consistency. When your effort is consistent, something will happen on the other side. It's not a maybe, it's a guarantee. It's to get people into that, frame of mind. But even when I was a resident, I realized how powerful that was, because, all the shifts in our schedule, we have night shift, which I disliked because I don't like to be sleep deprived. I don't like to be sleep deprived. I'm sensitive to it. I just feel really off. The next day I could deal with it, and I've gotten so trained in it that it's so easy for me to be like, I'm just going to get 4 hours. Even now, I'm like unlearning some of that easy default to sleep deprivation because it was such a part of our living. But I would exercise for 8 minutes before I got into the shower and get ready to go to night shift, because the 30 minutes was a lot. When night shift was going on, you come home, you eat, you pretty much had like 2 hours to just do some stuff.
Right.
It was easy.
And you prioritized movement. That's awesome. I definitely did not.
But I'm saying that was how I was able to find an opportunity. And so I would just do some calisthenics, jumping jacks for 8 minutes. But I was very consistent with it. And I noticed that my strength did not plummet. I felt like I was still active and fit somewhat. And I was like, this really worked? 8 minutes? So then I was like, you know what? It makes a difference. Small, but it's consistent. There's power there.
Yeah.
So those are the kind of things I've done. Just to answer your question. Prioritizing exercise for me, that's a mental thing. It keeps me mentally healthy. It keeps me sleeping well. I just have energy. And I check in with myself a lot. I'm always, because I'm an introvert, I'm always kind of thinking about what's going on inside. That's where I gain energy, reflecting on myself. So I always kind of know if this stress is I'm starting to see the stress kind of build up. All right, what are we doing? Let's make a shift. So I have a lot of, internal conversations with myself.
Yeah.
The habits that I built up, established during medical school, are what's serving me now in the stress of life as we move forward. So that was something that I felt privileged to have been put into place beforehand.
That's true. Wow. Yeah. Especially at a time when you were, I mean, we always say I'm so busy, but I used to have a mentor back then in medical school who would tell me, well, you're never going to be less busy. So if you feel busy now, so you put the systems in place. Yeah, I hear that. And then there were systems that, not just a system, it was a system that you enjoyed and was actually really possible. Like regardless of how busy it got, you could still maintain certain things. And there's a power in that consistency.
Yeah.
And people don't think if I only do 5 minutes. It's true. If you only do 5 minutes one day, it might have a little boost in your mood or something, but it's the power of doing that 5 minutes every day and showing up every day. And then she said the compounding interest that you get. I hear that. Yep. Well, maybe you answered this question. We end this conversation with, if you were coming to our health feast, so we're having like a big potluck health feast, and you're bringing your mindset tip or life philosophy, what is Marsha-Gail Davis bringing to the health feast?
I got a couple of things I'm bringing.
Okay, let's hear it. Yeah, there's no rule that you can only bring one thing.
Mm-hmm. So I think the power of hope is really amazing. I think holding on to hope is what carries us through life. So I think that's something that when we hold on to that, like that, this vision I have, this thing I want to do, where we're going to reach a better place. I think that you have to choose to hold on to that belief, and the choosing of holding on to it is what makes it alive. So I believe in that just across the board. The power of the small and consistency, like I mentioned, and that doing what really is what our gut is telling us and what's right, it will never fail us. That's like listening to gut instincts. They always turn out to be the right thing. So even though as we're in this system and we're doing this work and we know it's the right thing, and then the jadedness begins to try to steal the hope that we have, because that's our reaction to being like, golly, this is ridiculous. Why this is the way that it is. It's number one, a testament of our love for other people and our care for other people, that we really want so badly for things to be in a better space. And the discouragement from the reality that keeps showing up. But I think that's an act of resistance to continue to push forward. And I want to always know that I always push forward in that.
I hear that. I just say, you give me hope. We give each other. That's the power of you said it earlier, like we can bring each other up and impact each other. That's the power of this community. You didn't say it, but I think you're bringing community to the health feast too, because that's probably what's, if my takeaway from this conversation is really like, that is one of the biggest ingredients missing from a true healthcare system, is leveraging the power of community. And our current healthcare system is so disconnected from that.
That's exactly right.
Yeah. I'm going to think a lot more about that. And I encourage everyone listening too, like whatever community you're involved with, and it could be your faith community, it could be your professional community. How can you bring your interest in health and your desire to share this, in a way that kind of spreads the message and helps people, empowers people? Yeah. Okay. Yep. Okay. This is a wonderful conversation. I'm super excited that I got to talk to you. Poe sends his regards. He couldn't attend today, but we do our requisite fist bump to the camera. All right. Cool.
Oh, there we go. My bad.
Yeah. Here you go. All right, listeners, really appreciate having you here. We would definitely appreciate a review on your favorite podcast platform. And if you can subscribe and share, that would help the podcast out a lot. And we will see you back here next time on The Health Feast.
Thank you, Rock.
Thank you.